It is the largest medical center in the world, and it's known for advancing medical research and technology. Now, with the TMC Innovation Institute, the best minds in academia, science, and medicine can come together to create new solutions that'll shape the future of healthcare. Check out our recent conversation.
Well-known highlights at TMC include the Memorial Hermann Red Duke Trauma Institute, the Human Genome Sequencing Center, which was founded by Dr. Richard Gibbs at Baylor. There's MD Anderson Cancer Center, world-renowned for their cancer care. And then there's the Houston Methodist DeBakey Heart and Vascular Center. There's also the Texas Medical Center Innovation Institute, and that's what we're going to learn more about today. Here to discuss how they're changing the future of healthcare, we have Eric Halverson, Catherine Chambers, and Albert Wong. Thank you so much for joining us.
Thank you.
Okay, so first of all, Eric, I'm going to start with you. Okay, TMC, I think a lot of folks know TMC, but they don't necessarily know the Innovation Institute. Give me the skinny on it. What is it?
So the Innovation Institute was started in 2014, and it was really the Texas Medical Center's approach to trying to help entrepreneurs, help innovators, physicians, researchers who are trying to develop new treatments for patients, new drugs, new devices, and to support and translate those innovations and really bring them to the public where they can benefit them.
Is it, but like kind of very much in layman's terms, is it taking it from that think tank to the clinical trials?
Exactly. Everything in between, from an idea to a prototype, to testing it, understanding what that product is and what the unmet clinical need is, and then everything you need to do to bring that to market.
So what are some things that we would know of today that have come out of the Institute?
Out of the Institute? Well, we run 2 different cohorts a year at supporting companies. So we really vacillate between medical devices and digital health. And so we've got representatives here from both a medical device company and our digital health company.
Okay, so let's start talking first. Albert, I'm going to go with you with Allotrope. What's happening there? What's going on?
Well, once again, thanks for having us. So we at Allotrope Medical are creating medical devices that help surgeons identify critical anatomic structures when they're doing surgery. So helping identify things such as the ureter, which is a muscular conduit that drains urine from the kidney down into the bladder, and cases such as hysterectomies, colon resections, cancer operations, and really over 3 million operations around the US each year require you to find this little structure. And so we've created a handheld device that the surgeon can use now. Use a simple push button and it generates a visible contraction in that structure so they can identify it really quickly, shortens OR time, improves the surgeon confidence of where they're at, and hopefully improves patient outcomes.
So it's changing the way they do surgery for those certain types of surgeries.
Exactly. So that's what we're trying to do is really, we looked at what exists out there and saw that these things weren't really solving our problem or really not meeting the need, and we turned it on its head and created something that puts the power back in the surgeon's hands.
How long, like on average, does it take to say go from a concept to actually then doing the surgeries with that piece of equipment?
So it can vary. Hopefully for ours, it's a little bit shorter. We came up with the idea back in 2014.
Well, you are doing it with the best medical facility in the world.
Exactly. So really, since starting with the Texas Medical Center's accelerator to where we are now, it's been slightly over a year, and we've already gone through multiple design iterations, animal studies in the medical center, meeting a lot of the fellow entrepreneurs and investors through TMCX and organizations like that.
Is it because you're here and you have so much access to so many different types of surgeons and different facilities that you're able to move so quickly to advance?
Exactly. So largest medical center in the entire world is right here, and it's largely for right now, like an untapped resource compared to the coasts. So we have access to world-class hospitals, physicians, and then there's also a large amount of kind of public and investor interest now moving deeper and deeper into medtech that's right here. So we're right on the ground floor of it.
That is so awesome. So Catherine, tell me about The Right Place.
Sure. So unlike Allotrope, we are a software company. So Eric was saying at the Innovation Institute, they have device companies and software companies. So we're a digital health company. The Right Place is a software that helps hospitals find the right nursing homes that have beds for patients that need to be discharged. So,
oh my gosh, that is so critical.
There are a lot, I mean, we talked to a lot of Houstonians. A lot of our family members and friends have been through this experience with a loved one, with a grandparent or a parent that needs to go to a nursing home. And the process of a hospital finding where to send that patient is really done now through phone and fax. It's a really complex process, and unfortunately patients end up coming back to the hospital if they're sent to a facility that might not be the right one to care for them.
That just blows my mind that you're still having to use the phone and the fax when there's so much. I mean, even doctors with their patients are using so much technology.
Yeah.
And it's time for our senior citizens, our moms and dads, should be taking equally good care of them.
Now that's the benefit of the Innovation Institute. You get a lot of people from different industries, different backgrounds, taking maybe not necessarily complex ideas and applying them to healthcare. Our product or our company is an example of that. It's not necessarily a clinical decision support software, but it's a simple communication software that helps move patients to the right place of care more efficiently and helps improve the patient outcomes through that process.
What you're talking about is a prime example of how TMC works with individual hospitals.
That's right.
So cool. Yeah. I'm so fascinated. I mean, it sounds like there's so much, obviously going on, and it is just tremendous to me that what happens right here at TMC really goes and affects the entire world.
Yeah, I think we're just getting started, tip of the iceberg. These are two local, homegrown Houston innovators and entrepreneurs.
Yeah.
But we're also bringing in companies and entrepreneurs from all over the world. So our last class, 21 companies, 6 of those were international companies that are coming to Houston to be part of the TMC Innovation Institute and the Texas Medical Center.
And I bet it's like all different kinds of stuff, and it's just like you go in one room and it's a software to find.
For people like us, it's like a kid in a candy store for healthcare innovation.
It's a lot of, for the rest of us, it means potentially life-changing or going through a surgery where you can shorten that time that somebody's under anesthesia.
Absolutely. Right.
It's critical.
Yeah, absolutely. Absolutely.
I could talk with y'all all day long. Guys, thank you so much for coming in. Now, to learn more about the Texas Medical Center Innovation Institute, you can visit tmc.edu/innovation. There's much more Houston Life coming up after the break.